Hello Liz, and how are you this first morning in Miao?
I'm feeling great. I slept very, very well because I was very tired after my trip. I'm absolutely delighted and thrilled to be here. The place is absolutely stunning and the people are incredibly warm and friendly. And I'm looking forward to what we're going to find out.
And who did we meet at dinner last night? And on the train?
We met the Minister of Health from Dharamsala.
And what are you going to do today, the first day here in the settlement?
We are off to meet different people and to find out what the needs are and to build a network and find out how we can be most effective with our lottery money.
Starting with the health centre, I think.
Health centre, we're meeting young women to discuss perhaps sort of how we can make them more self-reliant.
아니, 내가 그거 지금부터 님을 줘.
니만이야 내가 지난 두주 교과신 디스티튜트 아니 지난 그 지용아 스테디메도 데시고도
디샤트.
나
야가티스 마음에로.
야가티스 마음에
디샤트 나서 건배 말아. 지단 대야 나서 막 쉬러 갔다.
나서 막 쉬러 있다 호화가 나서다 아니 침방 나서 근데 어떻게 침방 나서 얘기들에도 침방
창동 저거 말도.
디스타메로 상고도 지단 얘기 이거는 지금 세줄로된 어떤 제대이고요. 되게 양티스 가발 디스카운트던. 디티스 메로서 아니 보아던도 세줄랑 치도 랭에도 손주.
하기도 왜? 샤워지 제고 오면 왜? 샤워지 제고
Like first of the treatment the antibiotic from the shoulder review.
어디였냐?
Chronic ये मन नहीं होगा नहीं बनना.
아니 샤워지 제야 말이지. 제거라 오늘 좀. 이 complication checklist 도 아주 다시 한 말해. 샤워지 제야면 돼. 어떻게 만날 수 있대 그죠? 어떻게 세는 그거 연도 거서 인데 된다. 그래. 왜 그거? 대대 맞대.
거기 거기에서 풀 엑스프레스 맞대.
이 라페 그거로. 근데 그래. Very good. Great. You're saying it yourself.
Yes.
This is very important. Because she has been asking for this for a long time, you know. Yes. Very good.
They are between 2 and 4.
2 and 4.
And how often do they go?
Three primary nani, no singane. Shitanga. And two and after the They don't seem to have anything to play with or anything, you know, like. This is the one we were talking about, you know.
Yes, they're lovely.
If this has a little better material, then the quality becomes a little softer and better. You know? For this, they make jackets and also
Bags.
button bags, you know, shoulder bags.
여기 가던 농부촌 때 빠르다만 농번 하다니
Oh, there you are.
망치를 막 이렇게 시요. 근데 요것도 좀 되게 어려워. 한번 더 봐도.
하란 곳만 짜 하나.
사실 봄마당이랑 렉티 같이 자는 거 좀 재밌어. 다리 좋아. 게임 가리코네, 그니.
힘들죠.
이거나 봐도 좀.
그거 대셔.
대파를 강바도서 드레진 바기어와 대파를 쨍거 되든
Hello. So
So you see the picture?
Yeah.
It's very good.
Secretary Mr. Segal, representative CPS Miao, Sri Bidodji, other respected guests, parents, members of staff and students. First of all, I must pay my respect to the working of our schools. It is therefore my proud privilege, Madam, to read the report of this school to you.
Unji tanda Dr. Sharma de Dana Shingi de Ngazi Shingu and the Nganyamdo Yaroko ne Kuni Payori and under the laptop against the number and Dana laptop time and the laptop so to do now Koya to cover Jumze to get Tama two similar Shabbatone any Chalananda to the Dana Shingi that Hingi the King in Britain. Yunguenalia Lane, Talo, Shibitambaya Kalogori, and the Tiquati, Tando Motige, and the kitchen but rested in against the tissue and under the time I would Mount Perg sent the ticket charges and quantity to get down until Mount Perg gold 10 years and MG, that Haritoli Minik again, legit, so much. Yonseta, they were the contemplative Dilian as you tell the watermas on the church, they were chatting about it. So around her and jiggy. Lobjon Tolia, shoot to Nacha, so she should they should go to an Tunjunanguva. And Dana came Gavon, so Dana Pama to Sanga Tunjunangu. Jeff got the call, concentrated to something other the young and Yagocha was some best and Nale, so it can seem to delay this and bit. And then something. Yes, Samaya Mutije, and Charunyam de Naran asked.
Our department is providing every year they are providing food. So that way every school gets academic session. And afterwards 15 or 20 minutes for this prayer. Religious prayer. This is the regular session every day. So this is the
I see. That's good.
The animals.
Me also, yes.
यहाँ से मैं तेंजी कहाँ जा रही हूँ
ये तेजी का
अच्छा काफी दूर है
4 घंटा 4 hours.
नहीं
Then imagine the amount of that time, the journey.
Chest, stop chest.
그거 두드려 저기.
You can look. Excuse me. So this is the Chang.
Yes.
Help from Tibet Fund, Tibet Relief Fund. Come over. I think they're careful.
You know, all the water that is flowing out.
Do you know the sort of money that it would cost to...
Yeah.
These local ones, so you get, reduce that the rate. My name is D. Dorji. I'm the representative of this settlement, Miao Choephelling settlement.
This is one of the water tanks, I understand, for the camps.
Yeah, this is one of the 5 such water tanks that we have here. This is one of them, and it's supposed to supply water for 80 households, which means about a little over 500 people, 2 times a day. And now the water, it has so many disadvantages here. First thing is it doesn't have a height. to give to distribute water equally to all the camps, to all the households. And second thing is it has been here for some time now without any repair. So you can see it's leaking from all over, and you can see a barrel here, and so much water is being flowed out. So we need to do certain things about this. First thing, we need to have a respectable height so that the water that we store in this tank can be distributed effectively to all the houses. And second thing, we need to enlarge the size because it holds only about 5,000 liters water. Okay, so we at least need to double up the capacity.
Where does the water come from, Dorje?
It comes all the way from the foots of those hills that we visited this morning. We have two small reservoirs there, which are fed by the two perennial streams, and we bring it to this place through gravitational system, through pipes that are laid, and then this comes here, and then we distribute it to the camp people.
But it's not just a question of these tanks. I think in the settlements we need to do something in the hills where the source.
Yeah, you certainly, because you have seen the reservoirs there at the hills. First thing, they were all leaking. They were not. A lot of water was being was running out of the reservoirs there. So we needed to sort of harness all those water, which means we needed to put all those waters have all those waters flown into the reservoirs there, so that it will have more water coming into these tanks. And we have, as I told, we have 5 of these tanks all over the settlement.
Yes, at the source, the tanks seem to need to be cleaned out.
Yes, certainly that needs to be cleaned. We should have some kind of fundamental filter systems. And also we do have a roof over there. But you saw that it was So you saw it was kind of improvised stuff there. So we need to do the roofing also.
But now I understand you've been trying to organise a bore well, the Tibet Relief Fund.
Managed
to find the funds for
that project is very much on the card, but we are very suspicious about its being successful, because we had a rig here. Some 4 months back, they did about 5 spots, okay, and because of the underground rock formation, these people were not able to go beyond about 50-60 feet, and they were not able to find water, so they had to return, without having done the job. And now this second week, we are having some experts coming to this place to do a geophysical survey. And once the survey is through, we will have something about this place, whether our bore well is possible at all at this place. And if it is possible, we may have to go ahead with the bore well. Otherwise, we may have to ask Tibet funds to allow us to utilize this water instead of bore well for developing improving the infrastructure that is already existing in the settlement.
So if the bore well doesn't seem to be feasible, you would like the funds to be put into making sure we harness the water better from the hills there and into these larger tanks.
Well, I can see that's the only solution as a kind of sustainable alternative.
To see that the extension has been built to the health clinic here in Miao.
Yes, I'm very grateful for this extension, and I'm very happy that this time we are all here to see it ourselves. And this has been a very long need of the settlement, because during summer they get a lot of malaria cases, and when they have to give them indoor emergency cases, they don't have any place where they can accommodate them. So your help for this extension is going to be tremendous help, not only for the indoor patients but also for the lab. Now since that we're going to have a new lab technician here. And
the health needs of the Miao settlement, do you see?
Since this place being a malaria-prone area, it is very important, and also we have a lot of TB patients here, so it is very important to have a lab set up here, and for that we need a lab technician who could be trained for say 2 to 3 months, and then if she could start the test for the malaria, TB, and then also the Tibetan doctor yesterday was telling me that they also have a diabetes cases here, and if they have to go for a checkup in the Indian hospitals, they are very far from here, you know. Most of the hospitals are 3 to 4 hours trip from here, so if we could set up a lab technician and a small lab here, it's going to be very helpful.
Extension is built. What is the next stage?
Yeah, that is the thing. You see, with this new extension, we are able to now spare one room for day care, emergency care, indoor. Because during summer, they get a lot of emergency cases, especially the malaria patients. They need to be admitted here for drips and all that, you know. So with your extension, we are now able to vacate one room where we could have at least 5 to 6 beds, which is going to be very helpful for the indoor.
So you're looking for some last funding for 4 more beds?
Yes, 4 more beds, and also the equipment for the lab technician, and also with the bed, of course, we need beddings as well. Yes, and
what needs now of the health centre?
Well, you mean this health centre?
Well, perhaps more generally as well across the
yes, we are, as I already had a discussion with you yesterday, we are having a lot of problem with the running cost of the hospitals now, you see, and also the dispensaries all over, because most of the organizations who has been helping us for quite some time are now trying to phase out their help. So, and people like here, remote areas like Tizu, Miao, Tenzekang, and also we have other dispensaries in Sikkim and also in the remote areas of Nepal. We are having a lot of problem in getting money for the running cost of these hospitals, and especially on staff salary, because people like to help for other things like TB, immunization, MCH, but nobody is so much willing to pay the staff salary, and without the health staff it is very difficult to run the centers, you know. So this is one of our biggest problem faced, especially from this year. We are very much keen to raise funds for covering the salaries of the health workers and also the nurses and other lab technicians and pharmacists and doctors of 68 community healthcare centers and 7 hospitals all over India and Nepal. There are
Goodbye.